Hi, I'm Natalie and welcome to this short video on the primary survey. Since we gathered the results of our questionnaire that we sent out to instructors, we found that a lot of people are struggling with the new editions of D and E. So we've put together a demonstration that Chris is going to do, which talks you through each stage of the primary survey and explains what to look for when we get to D and E, disability and exposure. So I'm going to hand over to Chris now, who's going to talk you through a live demo of the primary survey.
Okay, so now let's get started with our primary survey demonstration. We've got our volunteer from our class. Thanks Natalie for volunteering for this session. It's really important we do our primary survey demonstration on a real person where possible, as opposed to using your mannequin, so we can get some real responses and we're actually checking the full person. So let's start at the beginning with our danger. So we're approaching our scene, a quick check around if we've got any idea what's happened here, what could be the mechanism of injury, no indication whatsoever. I've got some gloves that I'm going to put on as a precaution, and I'm going to ask loudly, hello, can you hear me? Are you okay? Can you open your eyes? I'm a first aider. I'm just going to tap your shoulders, and what I'm doing is obviously assessing for anyone, so gently check the shoulders. Is there any sign of a response? I'm not getting any response. I'm not going into any detail here about levels of response. I'm just assessing to see if there's an immediate response. There isn't, so I'm getting my phone and I'm going to dial 999 and I'm going to ask for the ambulance. Hello, can I have an ambulance, please? Okay, thank you. And I'm going to put my phone on speakerphone so I can continue to wait for the call to be connected. After assessing response, I'm now going to assess for catastrophic bleeding. So this is obvious signs of life-threatening arterial bleeding. A quick top-to-toe check, a quick look around. I see no obvious signs. I don't need to go into any detail at this stage. If I did find catastrophic bleeding, we need to stop the primary survey and deal with that. But we don't go into detail in our demonstration how we're going to deal with it. That is covered later on in the syllabus. So this is about a check for catastrophic bleeding. We will cover the detail later on. My next stage is to assess and open the airway. So for this, we don't suspect a spinal injury. We're going to do our head tilt and chin lift manoeuvre. Okay, we're going to assess for breathing. So we're going to use three senses to look down the body, listen for any sounds of breath, and feel on our cheek for any breathing. We're going to do that for no more than 10 seconds. Considering now also our agonal gasps, remember we're looking for normal breathing. Ask your students how they're breathing now and get them to consider that. Anything outside of that we consider as abnormal, and focus a little bit more on your agonal gasps and what that may actually sound like. This casualty is breathing. We've observed normal breathing, so we're going to continue on with our primary survey. And the next stage is circulation. So now we need to consider how this casualty is circulating. Is the blood being pushed around the body in a normal way? And a great way of doing that is inside the lips. We're going to look at the tissue colour inside the lips, looking for any blueness or any general grey or pale colour of the tissue. Perhaps there's some sweating, profuse sweating obvious on the brow, etc. I'm seeing no sign of that. I could consider capillary refill if I wanted by squeezing the fingernail and checking that the blood is refilling and it's going nice and pink again. Notice I'm maintaining that airway at all times. Now we come on to D for disability in the primary survey, one of the new additions. Now we need to treat this differently depending on whether we're doing a short first aid course or a longer course such as the first aid at work, where you will go into much more detail and cover a lot of the subjects later on in the course. I'm going to let go of the airway now as we're chatting through this next section. So, disability, impaired brain function. What can we consider in the unconscious casualty if we're not going into the detail of the additional subjects? Well, remember, we've got the call handler on speakerphone. We really need to rely on what that call handler is asking us. So under disability, they may be asking if the face is dropped, some signs and symptoms of a stroke. You can look at those signs and symptoms, pass that information, and they will tell you what to do next. You don't need that knowledge. Impaired brain function may also be because of blood sugar levels. So they may be asking any known history of the casualty. It may also be a brain injury. So they may be looking for any fluid from the ears or any head injury, any possible signs or history of concussion, depending on what the scenario has been doing. In more detail on a first aid at work course, you will be covering some more of these subjects around diabetes, head injury, concussion, etc. So you can cover those in more details as the syllabus goes on. So keep it short for your short first aid courses, and then consider E for exposure. So that is about a quick look. What obvious injuries? What am I seeing here? So I'm concerned about this leg in this position. Is this something that I can straighten out to put my casualty in the recovery position, or do I just maintain the constant check on the airway and breathing and leave them in that position? Take some advice from your call handler. Again, longer courses, first aid at work, we're now going to be thinking about a top to toe survey and moving on to the secondary survey. But that is more detail that is covered later on in the syllabus, when we then may need to assess if there was, may make more of a decision around that potential fracture, or maybe it's just a bent leg. So more detail for the longer courses and shorter detail in your typical emergency first aid course or things like that.
So now we've had a look at the demonstration from Chris, just a few summary points. The primary survey is lengthier with the addition of D and E. However, it should take about 90 seconds, as this is an assessment tool for life-threatening conditions, so needs to be completed quickly in a real-life situation. The other thing to consider is you can do a primary survey on a live casualty as well and talk to the person, and that actually helps when working through each stage of the survey, particularly on D&E, because you can ask questions and they can answer you. So we hope you found that helpful. If you've got any queries or questions about the survey, just get in touch with us, email or phone. Thanks very much.